feel my role as an orthopedic surgeon is to help people when they have minor injuries or overuse things to get back to what they were doing before, restore their normal life functions. One of the wonderful things about our practice is we treat almost all people, both sexes, and we treat people of all ages, so almost anyone can make an appointment to come see the doctors in our office. Well, I think since I've started practice, the latest trend has been the development of arthroscopic surgery, mostly in shoulders and knees, but most joints are now being scoped, and it's minimal surgery for big gains to really improve people's lifestyles. Orthopedic Associates Central Texas offers a wide variety of specialties. There's general orthopedics, which most of us in the practice do, but there's a hand surgeon, there's a spine surgeon. We have a doctor who treats spine problems non-operatively. Orthopedic Associates of Central Texas have been in Round Rock for 27 years. We're part of the community. We would like to feel like that we're not just doctors in the community, but also part of the community. When I started practice in 1985, I was doing general orthopedics. I've been very fortunate down through the years where I've been able to concentrate more on sports medicine and arthroscopic surgery. I guess I was always a frustrated jock, and this is my way of staying in sports and kind of being around athletes and maybe being around the athletes that I wanted to be. By far the most frequent procedure I perform is arthroscopic surgery, mostly knees and shoulders. That procedure has changed a lot down through the years. Back when I started doing arthroscopic surgery in the 1980s, we had to look through a little scope and a little hole, and the vision was poor, our instruments were poor, but down through the years we have high definition television that we look at, and we get a really good view of the inside of these joints, and our instrumentation enables us to do things that we never dreamt of doing in the 80s. We treat people of all ages in our office. There are many things that happen to children that can be treated by a general orthopedic surgeon. If it's a more complicated problem with pediatrics, we'll quickly make a referral to the orthopedic surgeons who specialize in pediatric orthopedics. My main goal is, first of all, listen to the patient, try to communicate well with them. I've seen doctors interact with their patients, and they do all the talking, and really it should be the patient that does most of the talking. And my role is to first listen and try to see how I can help them. I think my role as a physician is try to communicate well with the patient, and that means talking to them like another person. I don't want to use big medical words that they don't understand. I try to break it down into simple terms so that they understand what I'm trying to say. There's nothing more frustrating, I think, for a patient to leave the office and think to themselves, what did he say? We try to provide the best service to our patients, I think, by, again, listening, but also being available. You can't always take care of all their problems on one visit, and sometimes things change, and as long as we're available to them, I think we can take care of the patient's needs. A patient should prepare for surgery by asking all the questions. If it takes making a list, then they should make a list, come in and talk to us, make sure that we have answered all of their questions before they go to surgery. I think a patient should expect after surgery many things. Not every patient is going to go through surgery, and what they experience after surgery is not going to be the same for everybody. So I think they need to expect almost anything. My job is to prepare them for different possibilities, but they need to feel free to contact us if something doesn't seem right. Frequently My patients undergo outpatient surgery, which means that after they wake up, they're going to go home shortly after the surgery, and different things can happen in that first 24 to 48 hours, and they need to feel free to contact us with any questions. Normally, I'll see them within 2 to 3 days after surgery, and frequently we'll prescribe physical therapy for most things. I'm a big believer in physical therapy for most surgeries. Follow-up visits after surgery are very important. Frequently, well, every time after surgery, the patient is waking up in recovery. They don't remember anything that we tell them. And I'll communicate with a friend or a family member after surgery, but I think it's important to meet with the patient 2 or 3 days after surgery to let them know what we found, what the instructions are on how to take care of whatever we've operated on, and set them up for their post-operative care. And many times that may involve physical therapy or maybe a home exercise program. Post-operative visits should be individualized. I think the first visit in my practice is 2 or 3 days after surgery. Depending on what we've done, it might be a week later, sometimes to remove sutures. Sometimes it might be 3 or 4 weeks later if it's a fairly simple arthroscopic procedure on a knee. The thing I enjoy about my practice is that I've been here for 25 years in Round Rock. I've made a lot of friends, I've made a lot of contacts, I've been able to, my practice has evolved into exactly the type of practice I would have liked it to evolve in. And not many doctors can say that, but I enjoy doing arthroscopic surgery, I enjoy sports medicine. I've had the great fortune to be the team orthopedic surgeon for the Round Rock Express for the past 11 years. I work closely with Round Rock High School, so I've had the chance to pursue sports medicine and the type of surgery that I enjoy over the past several years. I've been very grateful for that.